Hey guys, welcome back to another episode of the Making Strides podcast. This is going to be another special guest episode where we brought on Stephanie Mundt. And Steph Mundt has been on this podcast a number of years ago. But I think that, Adam, do you remember the title of that episode? I think it was like
Exact
Things
title, I don't know.
PTs
Yeah, something
Need
to
to stop telling patients or something like that, right? It
yeah,
was a big myth
or
busting
something.
episode. Yeah, so go check that out. That was a ton of fun. But today is going to be a very interesting and potentially vulnerable kind of topic for us, all three of us, because the title, we usually don't have the title ahead of time, but we're pretty close on what it's going to be. So the title of this episode, which will pre-frame it pretty well, is Even PTs Get Stuck. What Our Injuries Taught Us About Rehab. And so yeah, this is going to be a really great talk, but let's introduce our guest again here first. So she's a physical therapist, running coach. She's based in Phoenix, Arizona. She specializes in that rehab and coaching side of runners with that emphasis on athletes with bone stress injuries and a history of just like restrictive eating, of course, with that being a huge contributing factor there. She's board certified orthopedic clinical specialist, and she has her CSCS, and she's also working towards a very impressive PhD in orthopedic science. She's just really super passionate about helping runners regain trust in their bodies and really establish that like fulfilling and sustainable relationship with movement. So that's what makes her especially important today. Hey, Steph, how you doing today?
Doing well. Thank you so much for having me. I'm super excited to chat with you guys.
Steph, you've had like such this crazy history of injuries. I know we're gonna like in a second, I'll go one at a time, all three of us, and highlight our most frustrating one. But just in a nutshell, real quick and dirty version of like the massive amounts of injuries that you've had. And then I want you to finish by just blowing everybody's mind with what you've been doing lately with your running.
Sure. So my first bone stress injury was in my junior year of high school. So, oh gosh, 20 years ago now? Crazy. And after that, there was just a slew of them, but I had an eating disorder and I was diagnosed with osteoporosis, or an osteoporotic level of bone density at that point, age 19. So a couple years after. And then since then, even though I recovered from my eating disorder and was in a better spot mentally, I still continued to get bone stress injuries until really the past 2 years. I've been bone stress injury free. And so that's been just a huge learning experience for me these past many years, I guess 20 it would be. And so I just ran 252 in Orange County Marathon, and I'm running 35 to 40 miles a week, doing very limited intensity. So I'm really excited for what that opens up for other runners with a history like mine, and knowing that they can be successful with maybe a different way of training than what we're used to seeing on social media or from the professionals.
Do you mind if I ask if you truly believed when you were in the thick of it with some of these injuries, if you truly believed you'd get back to high level running like you're doing now?
I think it was always a little bit there. Like, I know what I'm capable of, but it did seem so far away when it was injury after injury. And then I'm sure, as you both know too, that comeback process, you just don't feel like yourself. And I think it was actually when I finally accepted that I may not ever be as, quote, fast as I was previously, that it kind of felt like it took some pressure off and made running fun again. And it doesn't mean I think of your goals, right? But I think you have to be okay with having different goals in order to then develop and reach those. How about you guys?
Awesome.
Like, where are you at right now with that process?
Adam, I don't know if you want to go.
Yeah, I would say I'm still struggling to get to that okay point. Letting go of things that I thought I could do if I were to have been injury free the last 15, 20 years, pretty much the same time frame as you. I don't know. I'm especially like in the last few weeks, I feel like I've been like in a funk of like, what do I want my running to look like? Does it really need to change? Where do I want to take things? I just don't like know. Because it's just the last 2 years has been just not the same for me. When I fractured my ankle in this totally accident way that could have never been really prevented other than me not playing basketball that day. And I also partially tore a tendon in my ankle, just totally rocked my world. So I think I've had some glimpses, and I mean, obviously last fall went pretty well, but it's been just not feeling the same as I did before that, which was a really good spot. And it's just been trying to scrap and claw my way back to some semblance of normality, and normal is, which is maybe different than it was. And being, again, just okay with that.
Yeah, absolutely. I think realizing there could be a new normal, and that may be temporary, and probably is, right? Like I think why my performance is improving is solely because I've been able to be consistent for 2 years. There's no magic in the workouts I'm doing. It's more of the ability to be consistent. When you've lost that for so long, then it's so hard to get it back.
Definitely. Yeah. I think in my case, and I don't know, maybe this is relatable to other people that have had a lot of injuries. I feel like it's just, I'm kind of tired of fighting for fitness and like always coming back. And what if I just did 75% of what I want to do? And just like, could I be content with that? And more or less be injury free and, or have nothing like major going on and be happy with that. I don't know. To be determined.
Absolutely. Yeah, how about you, AJ?
You know what? I don't necessarily know because there's probably the aspect that we're thinking of speaking to, which is like where your body is, and then your reflection on what your performance is moving forward based on what you are dealing with and what you've been through. But for me, it's like where my life is right now. So like with having 2 young kids and the business being where it is and stuff, I just from like that biopsychosocial I'm kind of in like that chronic yellow light situation, sometimes red, where I don't know how responsible it is to really like have ambitious goals with my running right now until I get back to like a green light situation. So that I'm kind of trying to cope with. So that is frustrating for me, but I do know that I will get to a place where it will be green light again. I just don't know when that is, and it may not be for a couple of years. I also just don't know if I want to sacrifice as many hours as I have in the past on training for ultras and being super competitive and 50 milers and stuff. And I just don't know if I would want to, at this stage in my life, sacrifice those hours with my kids on top of it, right? So it's like at this point, it's like multifactorial, and I think I'm maybe just going to try and get back to consistent, strong running, maybe try and run a couple of shorter races, road races. I don't even know. We'll see.
Yeah, but I think that's a really important point too, and probably something that we've all taken away from these injuries is that life stressors play a huge role in these, obviously, Adam, yours was a traumatic injury, but even your ability to cope with the demands now, getting back into running after your body went through, I guess, relatively deconditioned state when you had to heal. And even now, I think as going through training as a, quote, maybe high risk athlete with a history of several bone stress injuries, like monitoring and managing those life stressors has become so much more apparent how important it is to keep us healthy and keep us injured. I think as we get older or maybe more experience, finally to the point where it's like, oh, that feels weird. I'm just going to take a week off instead of, oh, let's keep trying to run and see if it actually hurts.
Absolutely. Yeah, trying to avoid the RSS. I guess that's a Chris term, right? The runner stupidity syndrome.
Yes.
Or the RTF, rush to failure. He says that one a lot too.
I like that one too. Yeah. But what would it take? I guess what's the, because I think this is an important concept for people listening too, of red, yellow, and green areas, So what would you say is, like, what would it require for you to be in a green zone where you feel like you can push training a little bit more?
Yeah. It's an interesting thing that I actually kind of want to pick your brain about too, is like, how long does it, okay, let's just say stressors in my life go like decrease. How long do things have to be like that for full system restore? You know what I mean? Like, because some of these have chronic implications, right? Like I've been probably in this like hyper, I don't know, nervous system stress response state for like I mean, it could have been, I could be going on like 2 years of this. And I feel like, I've been going to therapy. I've been doing some things, some self-improvement things in certain areas. And anyway, so like, I feel like I'm doing better and I'm on like a path to success in that regard. But like, how long is it going to, like, will my body even be as resilient as it used to be before all of this, like even this year at all? Right? Like, even if things did just keep going well. So I don't even know when. I don't know.
Yeah. Yeah. I think that's a great question. And we definitely don't have an answer. I'm sure it's incredibly individual and theoretically, right, with the right environment and the right inputs, we can continue to be more resilient. And I would think that, I don't want to throw sunshine and rainbows at anyone, but I would think that you have the capacity to be just as resilient and fast as you were before. Then we also have the confounding variable of time, right? And with that,
Exactly.
there are some other changes that might be going on and just shifting priorities. I see this a lot with new parents too, where I just now my attention, energy, focus has to be on someone else. And so the priorities really have to shift.
Yeah. Yeah, I know I'll get there. It's just like, I don't know if it's probably not this year. And, but anyway, so like my goals that I had put, even in my paperwork when I consulted with you, what was that, 2 months ago now? I don't even remember,
I think so.
was to just race something this year, right? I technically already
You
did this
did.
past weekend, but no, like in like a more structured environment, obviously, like intending to race, like I didn't intend to race that day technically, but like this fall, right? And then like doing an ultra of some kind next year. And I think that's reasonable, right? How competitive could I be at that ultra? I don't know. That depends on a lot of factors, but so yeah, I just think that if I just continue to, manage my stressors, I think sleep is the biggest one probably, right? Like controlling your controllables, right? And so like sleep wise, I think I've realized just how freaking important it is. And if that's something you can control, meaning like if the limiting factor of you getting enough sleep is like what time you get to bed, that is highly in your control, as opposed to like having some sort of sleep disorder, of course. But like control your controllables. Like, man, okay, if I can just get 8 hours of sleep every night, I'm going to be way better off than I have been in the last year and a half, 2 years, right? So like start with some of those controllables. Anyway, so if I continue that trend, I feel like I'll be on a pretty good path towards the end of this year.
Yeah, absolutely. And I think like Adam, for you too, sometimes I think during injury recovery, when it's so prolonged or when it just keeps happening, you're on this roller coaster where I know at least I was supposed to run in college. I was on the team. I didn't race very much because I was injured, but it'd be like injury. Okay, now I'm running out of eligibility. I got to hit this hard injury. And I used to feel that way about my own body right now too, of like, oh, I'm getting old. I only have 10 more years of marathoning left. I got to run really hard. And that contributes to another injury. So I think also deciding, like AJ for you too, like what would be worthwhile for me from a race perspective? Do I have to be competitive for this to be worthwhile or improve my quality of life?
God,
Yeah,
I'm so
I think
competitive though.
yeah, there's kind of the question like, what does running mean to you? And what value does this add to your life? Is it purely, I just want to be fast and that being fast offers meaning or value? I would love to say no, but I think the honest answer is it really does, which just feels kind of shallow, which I hate. But there's another part of me that just loves it, loves going out there and just running, and I would do it even if I do, even when there's no race on the calendar. Like I'll have a relatively structured plan, do workouts and long run, like do it all. So I just like training. But I think back a little bit further, I think that AJ, what you're kind of alluding to is the ultimate question is like, at what point do I trust my body again to do all this? And unfortunately, unlike, it's like, okay, when can I run again? Okay, well, we want to check these boxes and like we can be pretty confident when we do that. Like you're going to tolerate running really well. There's no concrete benchmarks of when this is going to happen. And so you're just kind of like walking into the darkness, hoping to find the light at some point is what it feels like sometimes.
Yeah, that's such a great point. We do have these nice checklists and timeline for getting back to return to run and maybe getting back to typical mileage. But after that, getting back to maybe paces you were used to run or feeling how you used to is a big question mark.
I mean, I was very, very much in the dark. I feel like that when I was reaching out to you initially, Steph, after talking to Nathan, and like, I was just so confused and felt like, man, if I have to, I know Nathan laid out those boxes that I needed to check in order to get back to running and to start a return to running. And I don't think I would even still to this day be checking those boxes. And I know you had mentioned that. You're like, I don't think you're going to check those boxes for a really long time. And you were right. And so I was discouraged, and then I was encouraged when I talked to you.
Yeah. And that's an interesting thing too about different injuries. I think that's been one of my biggest learning curves the past few years, not necessarily with myself, because I think with bone stress injuries, you do need to check those boxes without pain. But when it's not a bone stress injury, which there are some things that are like, this is on the spectrum, I think, but some pain's okay. It's a very challenging injury and topic. But just from my experience, it's like, okay, if that puts heavy load on there and you can run without pain, even if you can't do the Copenhagen, let's run. So I think there are some times where the prerequisites may not apply.
Yeah, well, we don't have to get into it right this second, but it was extremely confusing for me because I literally couldn't, like, let's say I was crawling into my bed. Like, I literally couldn't even, lift my hip into open chain, like, extension or abduction. But I could go run for, like, my run walk. It's just crazy. Like, even still, like, I literally just won a trail 10K on Sunday, and even still crawling into bed, like, actually yesterday I was feeling like, and lately, just in general, I'm still feeling like that weird, like, weakness, pain when in like my hips, even in certain open chain positions. It's much better now, but it's still there. But I'm running. It's so weird. But yeah, so like there's these times where you could be extremely discouraged or confused and things are atypical. And yeah, that's what, and man, like we all have our experience and we learn from our own injuries, right? How to be better PTs, right? So maybe we go around and we can talk about like what was been like the most frustrating injury for us, and then like what you learned from it, right? So like a quick recap on why that was frustrating for you and then what you learned from it.
Absolutely. I can start. I think mine was actually probably a fibular stress fracture. It was originally misdiagnosed. It wasn't thought on the MRI until I got a second opinion. And which doesn't happen often, but, for anyone listening, in cases where there's high suspicion, get a second opinion. If your image is negative or you've been told that you don't have a bone stress injury, but you continue to have pain. So I kept trying to go back to running, and I didn't have an explanation for what it was. I think sometimes when we get imaging, we're still looking for something, but if it's not bone in my head, I was clear to run. And I just kept getting swelling. I also had some nervy symptoms, some numbness and tingling. Yeah, it was very odd. But after that second opinion, it still took, because I had continued to run on the stress fracture, it still took 4 months for this fibular stress fracture to heal and to get back to return to run. So all in all, this is a site that usually takes people like 3 to 4 weeks off. And it took me 6 months to get back. So I think one, I learned, it was my coach who pushed me to get a second opinion. So that was helpful. But even I knew my gut feeling was that something was wrong. So I think just learning to get that second opinion, trust your gut. And then 2, when I had started back to running, I still had some numbness and tingling, and I had to kind of retrain. And I've had to do this with my hip pain as well, because I have labral tears in both hips as well. But just working on my relationship to pain, because if I have something that's lasting, immediately I go back to that place of trauma, not being able to run for months. For me, I was also very heavily involved in my eating disorder at the time of a lot of these injuries. And so the threat of the pain is so much higher than if it's familiar pain or if I know that it's soft tissue pain. So I think working on my relationship with pain, what I was making it mean, and then also that second opinion piece for big learnings for me.
Adam?
Yeah, I'll go back to my ankle fracture 2.5 or whatever years ago now, and the partial tendon tear. And can you guys hear my dog scratching at the door?
Not much.
No. Okay, cool. It was just such a frustrating because I feel like for a long time there's nothing learned from it because it is just a complete accident. So there's always something. Every injury I learn something, or I have a refined perspective, and I'm just like, what do I learn from this? I just sat there. I had to sit there with that for so long, and then it was kind of like a double whammy because I didn't know the tendon piece to it until I started moving the ankle around, starting loading it, started go through some of the rehab. I was like, this isn't right. Like it shouldn't feel like this. And so technically I don't know that I actually had a tendon issue or a partial tendon tear. I just suspect that it was a case where I was like, I feel like I'm going to be better not knowing because even unless it's to a point that I can't function, I need surgery, which I'm not at. Like I'm just gonna go through the rehab process and it'll be fine. But I think through that I explored some other pieces of movement and was okay getting into I don't know what I call like some fringy type things that I would have initially been like, that is stupid. Why would you waste your time doing that? That really works like foot and hip and like it all together. It's not something necessarily loads super heavy. Like I was doing kind of all the different pieces, but I was more open to exploring some outside things than I initially just like, nope, immediately just like, I don't like it, get out of here. Um, so I think it's opened me up a little bit to explore other ideas in terms of movement and ideology and looking at things maybe a little bit more, even more holistic than I already was, and more so on the like psychology side, which I think, and which is probably the biggest thing I've taken away from it. But ultimately, I feel like I'm still in that process of learning and what I alluded to earlier, being okay with this. What do we really take away from this years later? Because I feel so, especially compared to the people that I was running with, that have just seemingly just taken off in the last couple of years and improved a ton, where I went like the opposite way, that it's always like a constant reminder and being able to be comfortable with that, come to terms with it. Maybe I get back there someday. Maybe I don't. Those are pieces I'm still trying to work through, figure out that hopefully 2 years from now, maybe we can do this again and I have something really profound for us.
Yeah, no, I think that's really valuable also to have perspectives from different points in the process too, right? Like we have all, I think, been in that spot. And of course, now being outside of it, we can be like, oh yeah, I learned this and everything's great now. But it's very different when you're like in the muck. I think those are really valuable reflections. And I get that it's still challenging to see the utility of it, or even maybe there's not a takeaway. And I think that's okay too. Like we can learn from it, but if it's just like, oh, that sucked. Also okay.
That leaves me. Yeah, obviously this injury has been by far the most frustrating. I would honestly say that I had a lot of kind of dumb injuries and probably wasn't training and approaching running the smartest prior to really starting to be passionate about working with runners and educating myself on the best practice of working with runners. And so I just was in that state, that period of time where I just didn't really know better. And a lot of those injuries were fairly simple and straightforward. And then I had like a 6 or 7 year kind of span where I really didn't have anything. It was very rare that I had anything that exceeded like a niggle. And then this happened, right? And so I went into having this injury, so osteitis pubis, which I didn't know what it was for the first couple of like almost months of dealing with pain. And so I went into this thinking I was just super resilient, like Superman almost, right? Like I hadn't had an injury in like years and I'm just so much smarter and it's not going to happen to me. I literally was like, oh my God, I was a gymnast growing up and like competitive Olympic style weightlifter through college. Like my bones are probably super strong. I'm like never going to have a bone stress injury ever. And then I end up with this. And then, so I think so I guess the why it was frustrating was because I couldn't figure it out. I could not figure out what it was. I needed an MRI to assist in that. And that's frustrating. But then also, I didn't really have any symptoms after like taking 2 weeks off after figuring out what it was. And then just by testing a couple of things, I've totally like flared it up and almost like seemingly changed its trajectory entirely and had symptoms literally to this day. So like now I'm like 7, 8 months out and still dealing with this, but it's just like I'm so confused in so many ways. And at every point of my like journey with this, from not being able to figure it out initially to feeling like I only need a couple of weeks off, then I could like test it with a couple of planks and bridges, and then I like flare it up. And then being so confused on how it's presenting with my symptoms, that feeling like I was like never going to get to a return to run. Thank goodness I spoke to you, Stephanie, and then like you encouraged me to start that sooner. And then I had like an extremely kind of like long and frustrating return to run where I found myself like stuck at levels like 1 to 3, 4-ish out of 9 or 10 or whatever you want to call it. I was stuck at levels like 1 through 3 and 4 for like 2 months, going backwards and forwards and backwards and forwards and backwards and forwards anyway. And then finally turned a corner and was able to finish everything out in like another month. And then here I am still, and probably going to continue to have symptoms as I return to run further for the next couple of months. So it's just been extremely frustrating, atypical. Like I've never treated a patient who's presented with something similar to this that presents like this. It's just so like humbling, right?
Mm.
And so I think the biggest things I learned was just that like you can't fit everybody into a box with a protocol. And you have to sometimes, you have to have structure and reason to it, and maybe some collaboration from other smart people. But in order to like bushwhack your way through it a bit, right? There's like no better word, I think, than just like grab a machete and like find your way sensibly. That will sometimes happen. And I think it's extremely hard with patients to get them to understand this sometimes. I mean, and we just had a patient today who called and I had a conversation with, who's working with one of my therapists who's having a frustrating like rehab journey and is going in a different direction. And like, so that is just like something that like maybe this is something that I need to continue to reflect on to then better build trust and communicate and educate my patients who are struggling with something similar. But yeah, I don't know. Still thinking about it and still going through it.
Yeah. Well, I think that's a huge point there too, is that we might have some protocols or suggestions, but they really are just created based on someone else's experience with maybe a similar or the same condition. But each person really does require their own journey. And for you too, having to pause or maintain, take a step back, go forward, take a step back, that part, having someone who is helping you and just kind of helping you deal with the mental aspects of that. Like it's adapting, this is okay, this is positive, just encouraging you through that process can be really important too.
Absolutely. Okay. So we're kind of at this like 30-minute mark. I guess, the take homes I wanted for listeners today are that, maybe some of our listeners are listening because they look up to us, right? Or I'm pretty sure anybody who's listening to our podcast knows that any of us three are just like, we're good at what we do. We're running specialists, physical therapists. We help tons of people, but like, that doesn't mean we like don't get injured. I think this concept of injury prevention is terrible, right? Because like there is no such thing as injury prevention. Okay. And anybody who is challenging their body is going to be at risk for an injury, right? And that even physical therapists need physical therapists. And so if like maybe you're listening, because I know a lot of people out there like even struggle to justify getting themselves a PT when they're not a PT, right? And so if even physical therapists are seeking out physical therapists to get help, obviously there's value in that, right? So if you're dealing with something, like please reach, it doesn't even have to be us, like reach out to somebody, get some help. Don't try and figure it out on your own. Dr. Google, Dr. ChatGPT, whatever we're doing these days. So that's kind of like the take home I kind of wanted for listeners was it's not always going to be a typical plan, trajectory, and like cookie cutter injury, and you're going to need a cookie cutter approach. And then the value of PT, like go and get a PT, get people in your corner to help you through stuff. Do you guys have take homes, or you can riff off that? I mean, whatever you want to do.
I think you did a great job. Yeah. I think the important points were really hit. And yeah, I think knowing that other people have gone through and experienced what you have experienced is really helpful too. So even, social media can be beneficial in that way. If you see people who have had a similar injury to you, then knowing that, you might reach out or work with them and they can understand what you're going through a little bit and give tips, but your journey's still going to look different.
Yep. Cool. Adam, you got any last final words?
Just to echo the like having somebody in a corner. Like I know I've had people, I had people that were frustrated at where they were at with things, and you can tell they are starting to second guess their decision of working with you. And like I always try to iterate when I start to get that sense of I'm equally frustrated. This isn't how we thought this was going to go based on how things presented initially, but know that I am here on this journey with you. Sorry, I don't have all the answers, and I'm not going to lie to you that and just like make something up out of thin air to make you feel better. But we are trying to actively figure this out. We are trying to try things. There is a lot of trial and error that I think people don't necessarily realize is in the rehab process. Because not everything, like essentially everything works, but not everything works for everyone or everyone's situation. And even a similar situation that maybe is presenting some years down the line may not resolve in the same way that you managed it previously. So just kind of being open with that, making sure that whoever you are working with truly is in your corner to that extent, and not just, I don't know what to do, let me go see this next person. So that would be my final thoughts.
Yeah, honestly, I think physical therapy as a profession, and physical therapy is extremely difficult in the sense that any other aspect of like the medical system, so therapies in general, I think are hard in general, right? Any other aspect of medical help is going to have like, especially like hospital-based stuff, right? Like my wife was in the ER. Somebody comes in with like a pneumothorax, there's a protocol. Somebody comes in with like diabetic ketoacidosis, like there are medications, there's a protocol for that, right? Like infection, protocol, medications. And somebody comes in with an Achilles tendinopathy. Yes, we have like a protocol for that, but the neuromusculoskeletal systems are extremely complex, and pain experience is complex, and everybody needs something that's a little bit different. And then, oh wait, it wasn't actually an Achilles tendinopathy. Oh, like now, you know what I mean? And so it's that problem solving, taking things to the next level, like touch points, and just make it like this relentless forward progress of like doing what you know you need to do. And it's difficult. It's hard. Right. And you're totally right, Adam. Like, I don't think that patients realize that. They come in sometimes, they walk into the clinic and they're like, well, if I can go to the doctor's office and they diagnose me right on the spot and give me a medication to fix it. Physical therapy should be the same. I walk in, I get a diagnosis, and then I get like a protocol to fix it. And it's not the case. Right. So I just think that this is a difficult kind of profession, in a lot of ways. Anyway, cool. We'll finish it there. And, thanks so much, Steph, for spending more time with us. Obviously,
Absolutely.
I mean, we could have you on the podcast. You could be like a permanent co-host if you wanted me to. You did have so much
Love to
value.
make more
You have
conversations.
so much. Yeah. So there's just so much that you can teach our listeners as well. So I'm sure we'll have you back at some point in the future, even if just to receive Adam's future 2-year down the line revelations that he's going to have. So thank you so much. Any last words from either of you?
No, just
No,
again,
that's it.
Yeah, thank you
Awesome.
so much
Thank you
for
so
having me.
much. Okay, guys, go make some strides.